Hi, I'm Stephen Kennedy. I'm here to talk to you today about my health care plan. Um, we all know how Obamacare is working and the extent to which some of those deductibles are becoming kind of outrageous. I also recently saw the one Donald Trump was forwarding and found some disturbing items in that. His maintaining the pre-existing condition mandates, but not offsetting them in any way with the individual mandates. Additionally, he left tax loopholes in there for the rich, and basically he would throw about 40% of the lower economy groups out of his health care and would once be back to a large amount of people with absolutely no health care at all. Conversely, I think I've put together an extremely comprehensive health care plan. And it kind of amazes me we haven't seen this before, but I know why we haven't. And I know I sound repetitious, maybe even a bit paranoid at times, but the health care plans we are being presented with protect the interest of the rich while totally ignoring the interest of the middle class. So my health care plan starts very easy. Kill the insurance companies. They don't need to be there for any reason at all. What do? They get all our money, hold on to it, make billions of dollars with it, and then squeak it out to us, fighting us every step of the way on what we deserve to be treated for, making us see multiple referrals through the insurance company who aren't even doctors to decide whether we need to see a specialist. No, we don't need them. We do not need insurance companies involved in our health care plan at all. So, step one, we are getting rid of the health insurance companies. Now, many of us still pay health insurance to an employer. What we do is we set up the mandatory health payment, which is directly related to the amount that an individual family can afford. You're actually already paying this, and that's the nice part. You're paying Medicare, so forth, through your payroll already. But, and it's a twofold idea I have, these monies do not go to an insurance company. They go to either one of two places. Either the state has a board set up to receive these, and the state, each of the individual 50 states, is responsible for it. But can we really trust the government with our money? I don't think so. So what an individual can do is they set up a payee for their amount of monies. It either goes to a hospital group, and those groups then have the money to do the same thing the insurance companies did with it, make more money off of it. So actually, this would directly benefit the hospitals who are distributing the health care. The end result is nobody gets charged anything. I don't care whether you have a pre-existing condition. I don't care what your circumstances are. Whether you're filthy rich, whether you're dirt poor, whether you have Crohn's disease, diabetes, anything. You go to see your primary doctor, who you get to pick. You get to pick your own primary doctor. Now, can you see other doctors still? Of course you can. Will the system still pay for it? Yes. You're not restricted to one physician. You can go see another one. Now, the only thing that comes in there is you've already picked your primary doctor. Now, if you need a referral, you go see your primary doctor, but now you have two doctors deciding what's going to be done. You don't have an insurance company, so they're not going to hook on their charges for you to see your referral doctor. Now, I was a kid, my parents used to see me Dr. Helfich down in Quincy Square, and we gave him some money, $5, $6, I don't know. I was a kid. I do remember getting the lollipops though, and those were good. He had great lollipops. There's a copay, $5 to $10, very affordable. Now, of course, if you go to ER at night or something like that, or a day surgery or something like that, copayment's a little higher, maybe as much as $30. This is not something that's going to break anyone. And you're not going to be denied treatment if you don't have your copay with you. It just becomes an item which they can bill out to you at another time. But we're talking about $30. the cost of everything are assumed by the hospital. Now, individual doctors, I'm sure, are going to work out plans with the different hospitals on practice and fees and so forth. But everybody is covered. A lot of the waste is trimmed off. Now, within this program, I do envision an oversight board. The oversight board would actually take care of if there are any complaints about medical care. And let's say someone says, I have a malpractice suit, they did me wrong. Goes to the oversight board takes a general look at it. Now, the oversight board cannot keep you from suing. If you go back and an attorney says, oh no, this is a great case, I don't care if the oversight board says you don't have grounds, we'll still pursue it, that can happen. But compare this to EEOC complaints. It weeds out a lot of the frivolous. It will discourage the frivolous. As a side effect, doctors who will probably still be purchasing malpractice insurance will see a drastic decrease. But the underlying point is this. When you get rid of the insurance companies, you get rid of the vampires who are sucking all the money out of healthcare. I worked as an RN for 22 years. I've seen this. So, we can have a national healthcare system which is not a single payer base. The hospitals and doctors would still be competing with each other to get more people signed up with them. And it's all, I don't want to say free to us, because you are paying to put money into it, but instead of putting money into the back pocket of an insurance company, you're putting it directly where it's going to help you in the long run. Now, I will say this, I'm not going to take complete credit for this. I looked at several of the more successful healthcare. The United States is 37th in healthcare in the world, which is a terrible number for a country like us. So I looked at the countries running successful healthcare plans, borrowed heavily from them, interjected a few of my own modifications, and we have a system that will work. Thank you. You all have a good day.